Okay, let's unpack this. When we think about the future, uh, our minds often jump to things like infrastructure, new technologies, maybe grand societal ideas.
Right, the big picture stuff, tangible things.
Exactly. But there's a foundational element that, well, it often gets overlooked. And that's the mental well-being of the young people who will actually build that future.
It's so fundamental, yet often pushed aside.
So today, we're taking a deep dive into exactly that. We've gathered a stack of comprehensive reports, looking at global perspectives, focusing in on India as well, examining how young people access care.
The quality of that care when they get it.
Yeah, and the broader societal shifts impacting their minds. So our mission here is to extract the most crucial insights. We want to understand the scale of the challenge, the profound barriers to support.
And also what's being done, what works, and what still needs work.
Precisely. So you, listening, will walk away with a much clearer picture of why this isn't just some niche issue, but something that really impacts all of us. So let's start with the sheer scale of this. It's kind of staggering. Did you know that globally, roughly 1 in 7 young people, aged 10 to 19, experience a diagnosable mental disorder?
1 in 7, that's about 14% of all adolescents.
Yeah, and it accounts for, what, 15% of the entire disease burden in this age group? That's huge.
It's a massive public health issue. And maybe the most frustrating part, as you said, is that the vast majority just aren't getting the care they need.
Desperately need. Now, let's look specifically at India. The burden there looks particularly high.
It does. While, robust national surveys specifically for children are a bit limited, the estimates we do have are quite sobering.
Right. They suggest something like 150 million Indians across all ages need mental health interventions. 150 million.
Yeah, and here's the kicker, as you put it, only about 10 to 15% actually receive appropriate care.
Which leaves this massive treatment gap. We're talking 70, even up to 92% in some estimates.
It's an astonishing gap. Really highlights the disconnect between need and provision.
And that's a powerful set of statistics to start with.
It is. And what's fascinating here, or maybe concerning, is that this isn't just an India-specific issue. It truly is a global challenge.
Right.
A joint UNICEF and Gallup survey, they looked at 21 countries, found that approximately 1 in 5 young people aged 15-24 frequently report feeling depressed or having little interest in daily activities.
1 in 5 globally.
And in the United States, that rate's even higher. It's affecting 1 in 4 young individuals.
Wow.
So given these, pervasive numbers across different contexts, it really makes you wonder, what's truly driving this widespread increase in mental health challenges among our youth?
Yeah, what are the underlying factors?
Well, the COVID-19 pandemic certainly acted as a massive stress multiplier. There's no doubt about that.
It just amplified everything.
Exactly. Think about it. Extended school closures, intense social isolation, economic hardships hitting families hard, widespread health fears.
This is a perfect storm.
It really created a breeding ground for anxiety, depression, stress among young people. And the studies confirm it. Common mental health problems worsened significantly during 2021. Particularly, it seems, among older teens and girls. We have new data from the CDC in the U.S. from 2021, for instance. It showed over 1/3, 37% of high school students reported poor mental health during the pandemic.
Over a third.
And 44% reported persistently feeling sad or hopeless. And what's truly shocking, 55% reported experiencing emotional abuse by an adult at home during that time.
55%. That's horrifying.
It is. And the data also revealed these disparities. We often see higher levels of poor mental health and attempted suicide among lesbian, gay, and bisexual youth, and also among female youth. It highlights how the crisis really amplified existing vulnerabilities, based on identity, socioeconomic status.
So if I'm understanding this right, the pandemic didn't just create new problems out of thin air. It sort of exposed and poured fuel on a lot of pre-existing vulnerabilities,
Right.
pushing those already at risk even further.
That's exactly right. It exacerbated underlying issues. But, beyond the immediate acute impact of the pandemic, we also see these contemporary lifestyle factors profoundly influencing youth mental health.
Right. Things that were happening anyway.
Yes. Increased digital engagement, screen time, it's that classic double-edged sword. On one hand, it opens avenues for teletherapy, for peer connection, which can be positive.
Complex.
But on the other hand, it's contributing to rising anxiety, major body image issues, pervasive cyberbullying, chronic sleep difficulties, young people often feel this immense pressure to keep up online, to present this perfect, curated version of their lives.
That pressure sounds intense.
It is. And then there's urbanization. Growing up in a city, it can mean high stress, constant noise, pollution, even exposure to urban inequality and violence. These environments are often detrimental to mental health, and adolescents seem particularly susceptible.
And you can't escape it easily.
Not easily. And layered on top of all that, we can't forget the persistent academic pressures and the general economic instability that adds substantial stress to young lives globally. It's a lot.
Wow, that paints a really vivid and, frankly, stressful picture of what young people are navigating. So for you listening, understanding these pressures isn't just like an academic exercise.
No, it's practical.
Yeah, it helps us recognize the signs, the challenges in the young people around us, whether it's our family, friends, students. I was struck by one fascinating finding from the CDC data you mentioned, the profound power of what they call school connectedness. Basically, a sense of being cared for, truly belonging within their school community.
That sense of belonging, yeah.
Youth who felt connected were significantly less likely to experience persistent sadness or suicidal thoughts. Significantly. Yet, fewer than half of U.S. youth reported feeling close to people at school during the pandemic.
Fewer than half. That really shows the impact of the disruption.
It really highlights a crucial area for intervention, doesn't it? Schools aren't just for learning math.
Absolutely not. They are vital hubs for well-being, or they should be. It points to schools as a vital point of contact.
Okay, so given this incredibly high prevalence we've discussed, and these mounting pressures from all sides, why aren't more young people actually getting the help they clearly need?
The access question.
Yeah. It turns out the barriers are, well, far more complex than just people not knowing help exists.
That's right. When we connect this to the bigger picture, a primary challenge globally is the sheer low availability of services. Just not enough places to go, not enough people to see, and they're often prohibitive costs.
Money is a huge barrier.
Absolutely. Public funding for child and youth mental health services is critically low worldwide, often described as practically non-existent in many low and middle income countries.
Practically non-existent.
Look at India, for example. Only about 1% of the total health budget is allocated to mental health. 1%.
That seems incredibly low given the scale of need.
It is. And it leads directly to a severe shortage of trained professionals. India, for instance, has only 0.75 psychiatrists per 100,000 people.
0.75.
Which is far, far below the WHO recommendation of at least 3 per 100,000.
Not even close.
Not even close. And then you add inadequate insurance coverage, inconsistent funding streams, fragmented programming. It all complicates access terribly.
It sounds like a systemic mess.
It can be. And tragically, there's a particularly egregious systemic barrier, one that's widely condemned as a violation of human rights. The institutionalization of millions of children globally with mental health conditions, putting them away rather than supporting them in the community.
That's deeply disturbing. Okay, so that paints a clear picture of the financial landscape and the workforce desert in many places. But beyond the budget and the number of doctors, what other practical, maybe societal factors are standing in the way?
Well, logistical barriers are often just as widespread as the financial ones. Think about it practically.
Like,
people are just too busy. They can't find available appointments that fit their schedule. Or they literally can't get to a provider when they're open, especially in vast rural areas where transportation is a huge limitation. How do you get there?
right, if the clinic is 2 hours away and there's no bus.
Exactly. And then there's the pervasive social stigma.
Yeah.
This is massive. The fear of harsh words, laughter, and abuse, as some studies put it, strongly deters young people and their families from even seeking help in the first place.
They're afraid of being judged, labeled.
Precisely. And this is particularly acute for youth with diverse identities who might face multiple layers of stigma. In South India, for example, qualitative studies show young people fearing being labeled mad, a term with extremely negative, damaging connotations.
Wow, mad. That's heavy.
It is. And crucially, tied into this, there's often a significant lack of cultural competence among providers. If healthcare professionals don't understand diverse cultural beliefs or the role of traditional healers or language differences,
The care won't connect.
exactly. It can be ineffective or worse, alienating. It makes building that essential trust really difficult.
It's striking how deeply culture impacts every aspect of this. Let's dig into something that affects all of us, often without us realizing it. Social determinants of health. We hear that phrase thrown around a lot.
We do.
But what does it truly mean for a young person trying to get mental health help? And why does it have such a powerful influence?
Yeah, this raises an important question. How deeply do factors outside the clinic walls really affect mental health access and outcomes? And the answer is profoundly.
More than we think.
Much more. Social determinants of health, basically, the conditions where people are born, grow, work, live, and age. These things actually exert a greater influence on overall health, including mental health, than genetic factors or even direct access to healthcare services.
Greater influence than genetics or doctors.
Really?
Yes. So, for example, poverty. It doesn't just make services unaffordable. It limits transportation options, affects nutrition, increases
It
stress.
touches everything. It does. Centuries of racism and discrimination drive inequities in housing, education, wealth, employment. This leads to systemic distrust of healthcare systems and often cultural insensitivity within those systems.
Makes sense.
Lower educational attainment can mean less awareness of what services exist or how to navigate the system. And those urban environments we talked about earlier, with the stress, the noise, the limited green spaces, they disproportionately affect marginalized populations who may not have the resources to escape or mitigate those factors.
So you can't fix the mental health crisis without looking at these bigger societal issues.
Exactly. Truly addressing the youth mental health crisis requires confronting these deep-seated social, economic, and environmental inequities head-on. It's not just about more therapists, it's about fairer societies.
Okay, so if gaining access to care is already such a massive, complex hurdle, what about the quality of care once someone actually manages to get through the door? What's quality even mean in mental health beyond just, getting an appointment?
That's a great question. The Institute of Medicine laid out a seminal framework years ago with 6 key dimensions of quality care. It should be safe, timely, effective, efficient, equitable,
Right, sounds logical.
and patient-centered. That last one is crucial, meaning care that's truly respectful of an individual's preferences, needs, and values. It's not one size fits all.
Patient-centered, okay.
But what's fascinating is that more contemporary literature, looking specifically at mental health, identifies 2 crucial additions to this framework.
What are they?
One is caring, just basic human empathy, treating patients pleasantly, making them feel heard and valued.
Seems obvious, but maybe not always practiced.
Sadly, no. And the second is navigating the system. This addresses coordination between different providers, continuity of care over time, and just the overall accessibility and ease of use of the system itself.
So it's not just the therapy session, it's the whole journey.
Exactly. Because if the system itself is a nightmare to traverse, if a young person or their family feels lost, confused, or like just a number being shuffled around,
Then even the best clinical care won't be fully realized. They might just give up.
precisely. Imagine finally getting to an appointment feeling vulnerable and then having no idea what the next steps are or feeling rushed and unheard. That undermines everything.
That makes a lot of sense. So if that's the ideal, safe, effective, equitable, patient-centered, caring, and easy to navigate, where are the biggest gaps in reality today, especially for young people?
Well, despite these clear frameworks, significant gaps persist everywhere. Many common mental health conditions are actually treatable at relatively low cost. The interventions exist.
We know it works often.
Yes, but the systems are severely under-resourced, as we discussed. This leads to those wide treatment gaps, but also, critically, often poor quality care when it is delivered. Maybe rushed appointments, maybe providers who aren't properly trained for youth.
Right.
Stigma, discrimination, and even human rights violations like that horrific institutionalization of children we mentioned are still very real barriers to quality, respectful care.
Still happen.
Still happening. Services are often fragmented and inconsistent, especially in places like schools, where support can be, as one report put it, hit or miss year to year. One year, a great counselor, the next year, nothing.
That inconsistency must be so damaging for trust.
It absolutely undermines trust and makes long-term engagement really difficult for young people and their families. And even when we talk about evidence-based treatments, there are still evidence gaps when it comes to truly patient-centered care.
What do you mean by evidence gaps there?
It means we often lack specific research on which interventions are most effective for specific types of children in specific contexts. So, for example, what works best for a 14-year-old girl struggling with cyberbullying might be different from what works for a 17-year-old boy dealing with intense academic anxiety in a different cultural setting.
So it's harder to tailor the evidence-based care to the individual child.
Exactly.
Yeah.
It makes delivering truly effective, personalized, patient-centered care for diverse young individuals much more challenging than it should be. We need more nuanced research.
Okay. It's easy to get, frankly, a bit overwhelmed by the scale and complexity of these challenges. Access, quality, funding, stigma.
It is a lot.
But it's really important to know that significant efforts are underway. People are working on this globally, and particularly in India. What are some of the key initiatives that are trying to turn this tide?
That's a crucial point. There is action happening. International organizations like the WHO and UNICEF have significantly scaled up their responses.
What are they doing?
Well, they have initiatives like Helping Adolescents Thrive and a joint program rolled out in 2022 across 13 countries. These have already reached over 6 million young people with mental health promotion and prevention activities, things like building resilience, coping skills.
Prevention is key.
Absolutely. And they've improved access to services for over 10 million young people annually through these programs. The WHO also actively encourages integrating youth mental health into primary care.
Meaning seeing your regular doctor about it.
Exactly. Through programs like MHGAP, which helps train general healthcare providers, not just specialists, to identify and offer basic mental health support. This vastly expands the reach, especially where specialists are scarce.
Smart. Using the workforce that's already there.
Precisely. And we also see countries like Australia with its well-known Headspace centers offering youth-friendly drop-in services, and the UK expanding school counseling. Both really focus on early intervention and making it easy, non-stigmatizing for young people to access care.
Okay, so that's the global picture. Now, India specifically, you mentioned they have a robust framework. What are the big policies and initiatives making a difference there?
India has rolled out some really significant and comprehensive policies. The National Mental Health Program, the NMHP, it actually dates back to 1982, but its District Mental Health Program, or DMHP, now covers virtually all districts.
All districts, wow.
Yeah, providing community-based services, counseling, suicide prevention right at the local level, trying to bring care closer to people.
Decentralizing it.
Exactly. Then there's the landmark Mental Health Care Act of 2017. This is huge. It guarantees the right to access affordable, quality mental health care for all citizens. And crucially, it decriminalized suicide.
That's a massive shift.
A profound cultural and legal shift. Viewing mental distress as a public health issue, not a crime. Reducing stigma, encouraging help-seeking.
What about more recent stuff, especially around COVID?
Right. During the pandemic, the Ministry of Education launched the Manadarpan Initiative in 2020. This offered psychosocial support specifically for students, teachers, families, coping with the stress of COVID, and included a dedicated national toll-free student helpline.
The dedicated helpline, that's great.
And building on that, perhaps one of the most innovative and scalable models is the National Telemental Health Program, Telemanis, launched in 2022.
Telemanis. Tell me about that.
It's a 247 national telecounseling service. It's accessible in 20 different languages, which is vital in India. And by February 2025, it had already handled over 1.8 million calls.
1.8 million calls.
Yes. It's been praised by the WHO as a really promising practice for reaching such a vast and diverse population using technology.
That sounds incredibly impactful.
It really does seem to be. India also now has its first dedicated national suicide prevention strategy from 2022. The goal is ambitious: a 10% reduction in suicide mortality by 2030, with a strong emphasis on early intervention and screening, particularly in schools.
Targeting schools again. Makes sense.
And beyond these big headline policies, there are ongoing efforts to integrate mental health into primary care, like we discussed globally. There are comprehensive school health programs being rolled out with mental health modules and teacher training. They're working on expanding the specialized mental health workforce with new centers of excellence for training. And they're using digital platforms like IGOT Diksha to train frontline health workers efficiently, allowing for standardized, accessible training even in remote areas.
Okay. That is a truly comprehensive suite of policies and programs.
Yeah.
Sounds like there's a real commitment, at least on paper. But earlier, we talked about those severe funding shortfalls globally.
Right. The elephant in the room.
Is India facing this same challenge despite these robust frameworks? Is the money actually there to make it all happen?
That's a critical point to consider, absolutely. While these fantastic policies exist, funding definitely remains a major concern. As we mentioned, India allocates roughly 1% of its total health budget to mental health.
Still that 1% figure.
Yes, which translates to about 180 million US dollars. Experts, advocates, almost everyone agrees this is just not commensurate with the immense scale of the need we've outlined.
It sounds like a drop in the ocean for 1.4 billion people.
It does feel that way. Advocacy groups are consistently calling for major budgetary boosts because without significantly greater investment, scaling up these crucial services to reach everyone who needs them, implementing these policies fully, it remains a huge challenge.
The best plans need resources.
Exactly. And interestingly, the government's own economic survey highlighted this. It stated that India's demographic dividend, that potential economic boost from having a large young population, depends directly on the mental well-being of its youth.
Linking it to the economy.
Yes. And it explicitly recommended increasing resources for mental health. So there seems to be an understanding, at least in some quarters, that this isn't just a nice-to-have health issue, but it's actually fundamental to the country's economic future.
Okay, so it seems like the roadmap, the policies, they largely exist, especially in places like India. But what are the biggest hurdles in actually building that road, making these incredibly important initiatives truly impactful on the ground day to day?
Well, a critical bottleneck we keep coming back to is the severe shortage of trained mental health professionals, especially the distribution they're heavily concentrated in cities, leaving rural areas desperately underserved.
Right, the numbers you quoted earlier were stark.
They are. Some studies show rural counties having maybe 60% fewer psychologists, 40% fewer social workers per capita compared to urban areas. And it's not just about training more people, it's what some call a leaky pipeline problem.
Leaky pipeline, what does that mean?
It means even when professionals are trained, maybe through these new centers of excellence, lack of consistent funding for positions, lack of supportive working environments, professional isolation. It means they may not stay in those underserved areas or in youth-specific roles long-term.
So they train, and then they leave for better opportunities elsewhere.
Often, yes. So sustainable solutions require not just training, but long-term, stable funding for positions and robust workforce incentives, financial and non-financial, to attract and retain talent where it's needed most.
Makes sense. What else? Stigma.
Oh, absolutely. Overcoming stigma and promoting mental health literacy is vital. Stigma remains this profound barrier rooted in fear of judgment, misunderstanding, misinformation.
And you just don't get it.
Often, societies fail to see mental health as this positive continuum of well-being, like physical health. Instead, it's seen as something binary. You're either fine or you're crazy, something to be hidden. So efforts really need to include sustained public education campaigns that normalize mental health challenges, that share stories, that remind young people and everyone else that it's okay not to be okay.
Changing the whole conversation.
Exactly. And expanding comprehensive mental health education in schools is absolutely vital for this, starting young. Alongside that, cultural competence training for professionals is essential so they can provide care that feels respectful, relevant, and safe for diverse populations.
This raises an important question then. How do we move from these often fragmented services we've described, a bit of help here, maybe a program there, to a truly supportive, integrated ecosystem for young people, both offline and online? What does that actually look like?
That's the goal, isn't it? An ecosystem. Supporting youth mental health effectively requires a truly concerted collective effort that cuts across the traditional silo.
Breaking down walls between departments.
Yes. We need to integrate health, education, social protection services, even potentially juvenile justice systems, everyone talking to each other, working together around the young person.
And schools are key in that.
Schools are crucial partners, as we discussed. That school connectedness is such a key protective factor. So strengthening mental health support within schools is critical. The ultimate goal should be a no wrong door approach.
The wrong door.
Meaning any point of contact for a young person, whether it's a school counselor, their family doctor, a youth worker at a community center, should be able to effectively assess their needs and facilitate seamless access to the right level of mental health support. No dead ends.
So everyone knows where to send someone. or can offer basic help.
Exactly. But this requires genuine intersectoral collaboration, shared protocols, maybe even shared data systems with appropriate privacy safeguards to ensure continuity of care and that kids don't fall through the cracks.
That sounds like a big organizational challenge.
It is, but it's essential. And beyond the services themselves, we also need to think about actively designing mental health friendly environments.
What do you mean by that? Like physical spaces?
Physical spaces, yes, but also social and digital environments. For urban settings, this could mean prioritizing life skills education in schools, truly valuing youth input in urban planning processes.
Asking young people what they need.
Yes, providing safe, accessible public spaces for social connection, for recreation. And actively addressing those adverse social determinants, we talked about things like housing instability, lack of access to green spaces, community safety.
Making the whole community healthier.
Right. And in the digital realm, establishing clear screen time guidelines promoting digital literacy is crucial for fostering balanced online environments. Because while these platforms enable vital peer connection, we know the potential for negative impacts. Body image, cyberbullying, sleep disruption needs careful management by families, schools, and even the platforms themselves.
It's a balancing act online.
It really is. But on the positive side, telehealth interventions like India's Telemanas have proven incredibly effective and hold immense promise for expanding access, especially to those in remote areas or those who face mobility challenges or stigma about physically going to a clinic.
So technology can be part of the solution too.
Definitely. A powerful part if used thoughtfully.
Okay. So for you listening today, we've really unpacked the sheer scale of the youth mental health crisis. We've gone from global prevalence to looking closely at India's specific significant challenges.
We've seen the complexity.
Yeah, we've explored that complex web of barriers,
Mhm.
systemic, financial, cultural, societal, including that profound, often overlooked impact of social determinants of health. It's not just about what happens in the clinic.
Not at all.
But importantly, we've also discovered promising initiatives, real signs of progress. From India's pioneering Telemanas helpline and its really comprehensive policy framework, to global efforts pushing for integrated care and much stronger school-based support.
There is hope and action.
Definitely. And we've understood that quality mental health care means far more than just getting a treatment that works on paper. It means deep caring, real empathy, and the ability to help young people navigate a system that can be incredibly complex and intimidating.
That human element and the system navigation are key.
And the pathways forward seem clear, if challenging. Tackling those workforce shortages, actively dismantling stigma through education and conversation, and fostering these integrated, truly youth-friendly environments, both in our communities and online.
It's a multi-pronged approach that's needed.
It really is.
And, when we connect all this back to the bigger picture, the evidence is just undeniable. There's a staggering global funding shortfall for youth mental health. UNICEF alone estimates needing hundreds of millions more annually just for its current initiatives, let alone scaling up.
Hundreds of millions just for UNICEF.
Yeah. And this raises, I think, a really important, maybe provocative question for all of us. Given the enormous economic and societal costs of inaction, the direct impact on national productivity, on innovation, on the very resilience of our communities.
The costs of not addressing this.
Exactly. How do we collectively shift the narrative? How do we move from seeing mental health investment as merely a cost on the budget sheet to recognizing it as an undeniable business imperative for our shared collective future? How do we make the economic case just as strongly as the compassionate one?
That's a powerful reframing. Mental health not as a cost center, but as a strategic investment.
Precisely. Because the returns in well-being, productivity, social cohesion are immense.
This deep dives truly shows us that investing in the mental well-being of youth isn't just, an act of compassion, though it certainly is that. It's a strategic long-term investment in the future potential of entire communities, entire nations. It really is a collective responsibility that we all share.
So what stands out to you from today's deep dive? What's maybe one area you'll be paying more attention to, or perhaps exploring further after listening? We really encourage you to keep asking questions, keep digging deeper, and keep learning about this critical